Charlie is a student in your class. His parents are going through a divorce and have been inconsistent when it comes to who is picking Charlie up after school. Sometimes it is his mom or his dad, but it has also been a neighbor or his grandmother. Charlie is often uncertain who will be picking him up, and it is causing him anxiety. What can you do to help Charlie ease his anxiety? A. Speak to his parents and ask them to provide a weekly schedule of who will be picking Charlie up each day. B. Take a picture of each person who might pick Charlie up and use the pictures to help Charlie understand who will pick him up that day by attaching the correct picture to his cubby. C. Set up a short meeting with Charlie's parents to explain to him what you're seeing and work with them to devise a plan to help ease Charlie's anxiety. D. All the above. Answer: D. Charlie is just a little boy and divorce is a grown-up issue, one he can't possibly understand. A child's world is much smaller than our own, so to Charlie, who will be picking him up is a big deal, and he will worry if he's not sure. Doing whatever you can to assure that Charlie feels secure is an important part of being one of Charlie's caregivers. Make a special effort to assure Charlie each day he will get picked up and where he will be going after school. Using a picture chart and gentle reminders will help him during the day, as will working with the parents to confirm the plan daily and to share with them how Charlie is doing during this difficult time. One of your students tells you he's driving with his family to South Carolina tomorrow and it's a 12-hour car ride. What can you do to make this a teaching moment for him and his classmates? A. Tell them about the 50 states and how South Carolina is south of where they live. Count to 50 to show them that it's a lot of states. B. Tell them South Carolina has a lot of beaches. Have them color a picture of a beach. C. Show them a map and let them drive a car from your state to South Carolina. Leave the map out for a few days so they can explore it on their own. D. Tell them South Carolina's state bird is a Carolina wren. Show them pictures of the birds. Answer: C. All of the activities will help them talk about South Carolina. However, letting them drive a car on the map through the states will give them a hands-on tangible experience and open up the discussion for the different states he will drive through, things he might see and what he might do to keep busy in the car. Leaving the map out will allow the students to explore and ask questions at their own pace. Which of the following should be considered an unsafe toy for indoor classroom play? A. Rubber ball. B. Ride-on toy. C. Plastic baseball bat. D. Sand. Answer: C. A baseball bat, even a plastic one, should be used outside. In an indoor confined area, like a classroom, there isn't enough room for the students to safely swing the bat. Many classrooms allow ride-on toys inside, especially on days when outdoor play is not possible. It is important to set up classroom rules for using the bike inside. Which of the following are examples of engaging children while reading? 1. Hold the book so all children can see the pictures. 2. Ask the children to predict what will happen in the book based on the cover. 3. Ask the children to be very quiet so you can read. 4. Tell the children not to ask questions until the end of the story so they don't miss anything. A. 1 and 2. B. 1 and 3. C. 2 and 3. D. 3 and 4. Answer: A. When reading a book to children, you want to engage them in the story. Make sure every child can see the pictures, speak clearly and use a tempo that goes with the story, use fun voices for different characters, use facial expressions and give them opportunities to predict what will happen next. Sally Ann and are the mothers of 2 of your students. They think Carol's son, also in your class, should be wearing a hat today because it's so cold and tell you so. They indicate they can't believe Carol did not send a hat in for her son to wear. You should A. Agree with them, it is very cold today. B. Tell them it's not any of their business. C. Thank them for their concern and tell them you'll see them at pickup. D. Call Carol and tell her to bring a hat right away. Answer: C. Unfortunately, you will run into situations where parents talk about each other. The very best thing you can do, while staying professional and kind, is to stay out of it. You never want the parents of your students to think you are involved in gossip about them, and you will lose their trust if they catch on that you are. How often should you observe your students' developmental and educational progress? A. Daily. B. Weekly. C. Monthly. D. Regularly. Answer: D. As an educator, you should become comfortable with classroom observations, being able to informally observe your students regularly, meaning it should be part of your regular routine. You may observe one child counting higher than he has before and another who is starting to show signs of behavioral concerns at the same time. Michael is 3 and is not interested in learning to use the toilet. You should A. Put him in time out whenever he soils his pull-ups. B. Encourage him to use the toilet at regular intervals. C. Make him sit on the toilet every 30 minutes for at least 5 minutes. D. Don't even bring the subject of toileting up with Michael. He's not ready. Answer: B. Since Michael is 3, he is developmentally ready to begin to use the toilet, however, he may not be personally ready. Encourage him to try at appropriate times, such as before meals, before recess, after meals and during transitions. Do not focus on it, suggest it to him and let him make the decision. He will use the toilet when he is ready. Putting extra pressure on him could discourage him from trying. How can your library selections help your students develop a sense of self? A. They really can't, books are more for their enjoyment. B. Having books with a variety of pictures and stories such as single-parent families, adoption, or the birth of a sibling, can help them identify with their own situations. C. Picture books for children who can't read. D. Having books in Spanish will help students develop a sense of other cultures. Answer: D. Books that offer children stories that reflect their lives help them to identify with the characters and begin to better develop a sense of self. When the children are on the playground one afternoon, Johnny slides down the slide before Stephen has gotten off. Johnny hits Stephen in the back and Stephen, though not physically hurt, begins to cry. This is the first time Johnny has ever done this and he is visibly upset, too. What should your response be to this situation? A. Send Johnny to timeout for not following the rules. B. Remind Stephen he needs to get off the slide immediately when he's at the bottom. C. Sit both boys down and help them talk through what happened and go over the slide rules with them. Ask them what they can do next time so no one gets hurt. D. Tell them both they are fine and to go play, it's best not to make a big deal about it. Answer: C. Using this minor accident as a teachable moment, you can let the boys work out for themselves what happened and how they can avoid that in the future by following the safety rules you have established. Walking, running, jumping and skipping are examples of A. Cognitive learning activities. B. Gross motor activities. C. Small motor activities. D. All the above. Answer: B. When children use their large muscles, they are engaging in gross motor activities. Children should be given the opportunity to use these muscles every day, both indoors and out. Your classroom mom wants to have a Halloween party with a costume theme, but some of the mothers are unhappy because they have already bought costumes and don't want to buy another one just for the party. How can you help with this situation? A. You really can't, it's up to the classroom mom, and if she says it's a themed costume party, then that's what it is. B. Contact the classroom mom and let her know what the other mothers are thinking. Make sure she understands how much you appreciate her help, but it's important that the party be focused on the children and their experience. C. Cancel the party and do something for the children yourself. It's best to just have a small party than upset anyone. D. Tell the classroom mom she can't have a themed party, it's too upsetting to some of the other moms. Answer: B. Some parents love to plan events for their child's school and can, at times, become very attached to their idea even if others are not. While this can be a frustration, remember they truly just want to help. Forming a relationship with your parents and being able to discuss these things with them can save a lot of hurt feelings and allow for the focus to remain on the children and providing them with a positive experience. You have 3 Spanish-speaking students in your classroom. Their mothers want to come in and help the kids make homemade tortillas. Your theme this week is zoo animals and you're going to the zoo on Friday. You really don't have time for an extra activity. What should you do? A. Wow. This is a great activity for the kids. Change your schedule a little so you can accommodate this wonderful offer from these moms. B. Tell them it's a great idea but you just don't have the time this week. C. Tell them it's a great idea. Can they do this activity in May when you cover Cinco de Mayo? D. Cancel the zoo trip, you don't want to upset the parents. Answer A. If it won't truly upset your week, be flexible and let these moms come in and do this cooking activity with the children. Think of all the great concepts they will cover. If it works out well, you can invite them back for Cinco de Mayo to further share their culture and traditions with your classroom. Your classroom teacher is doing a unit on safety and wants to have the children role play what to do if there is a lockdown. Which of the following answers best describes this activity? A. This activity will scare the children and she should not have them participate. B. This activity is too difficult for them and they won't understand. C. This activity will help children learn by being active and engaged and give them a chance to practice what to do in a true emergency. D. This plan won't make a difference. In a true emergency, the children will not remember this activity. Answer C. A good teacher helps children learn appropriate safety practices and does so in a safe and supportive manner. Providing children with the opportunity to learn what to do in an emergency will help them remain calm and feel more secure should a true emergency arise. During a preschool snack time, Carletta spilled her drink and Harold got wet. He pushed Carletta and said that she had done it on purpose. What should the teacher do in this situation? A. Send both students to the timeout area. B. On Carletta's daily report, tell her parents that she is having trouble handling a cup and suggest that they send a water bottle or covered cup the next day. Clean Harold up. C. Take Harold aside and explain that Carletta had an accident. After cleaning him up, discuss the incidents with both students. D. Reprimand Harold for pushing and shouting by taking his snack away. Clean up the spilled drink and give Carletta a new one. Answer C. It would be best to remove Harold from the scene, clean him up, and explain what happened. When he has calmed down, you might sit with both children so they understand what happened and what each could have done to prevent the accident and the reaction. In this situation, it would probably be inappropriate to send Harold for a timeout since he was reacting to an unsettling situation, not deliberately misbehaving. Which of the following would be found within Section C Competency Standard I of a professional CDA portfolio? A. Training certificates/transcripts. B. Family questionnaires. C. An activity for creative arts. D. Proof of completion of a first aid course. Answer D. Section C Competency Standard I should include proof of completion of a first aid course and a pediatric CPR course, a menu for 1 week, and a weekly plan of learning experiences. Certification in CPR or first aid must be from a nationally recognized organization, such as the Red Cross. The CPR course must specify pediatric CPR. There are different types of CDA accreditations, each applicable in different situations. Which is not a recognized CDA endorsement? A. Health and Safety Officer. B. Center-based preschool. C. Home visitor. D. Bilingual education. Answer A. Each accreditation is applicable in different settings. CDA endorsements are center-based infant-toddler, center-based preschool, family child care, home visitor, bilingual, and special education. The candidate for endorsement can choose from any area in which she is currently serving or hopes to serve. Each endorsement has specific requirements which can include training and service hours. Health and safety standards can be included in any of the areas. Which is the best strategy for helping toddlers, ages 18 months to 36 months, feel safe and secure in care? A. Share experiences and behavior patterns with the child's family. B. Establish a separation routine which is applied for every child. C. Ignore undesirable behaviors and support desirable behaviors. D. Set developmental goals for each age level and plan curriculum accordingly. Answer A. Communication between home and care center is vital. Working together, parents and caregivers can develop strategies which will make separation times easier for both children and adults. Parents and caregivers should share information about situations in which children feel either comfortable or stressed and plan to support each individual child. Open communication is an important part of child care. Each child will develop at different rates and in different ways, so set standards and routines may not suit each individual child's needs. Which of the following is an example of a small motor activity? A. Reading a book. B. Playing hopscotch. C. Doing a puzzle. D. Taking a walk. Answer C. Children develop their small motor skills by doing activities with their small muscles. Puzzles require them to use their fingers to pick up small pieces, which is a pre-writing skill. Giving them ample opportunities to use these muscles will help them develop valuable skills toward kindergarten readiness. The Child Development Associate Credential, CDA, is based on which of the following qualifications? A. Seniority in the system. B. 4 years of college credit plus 2 years of service. C. A core set of competency standards. D. Receiving a high school diploma or getting GED certification. Answer C. The CDA credential is based on a core set of competency standards which help early child care professionals become qualified as teachers of young children. These include standards for health, safety, physical and intellectual competence, and maintaining positive social, emotional, and productive relationships with children and their families. Maintaining confidentiality is a professional standard for all caregivers. Confidential information which should be protected includes all but which of the following? A. Information about program policies. B. Information about children. C. Information about program families. D. Information about individual educational plans. Answer A. Information about children, their families and individual educational plans should be kept confidential and discussed with discretion only with appropriate staff and support personnel. Strict confidentiality concerning the private issues of children and families should be maintained, except for the purposes of reporting instances or suspicions of neglect or abuse as required by the state or policies of the child care program. You are planning a unit on doctors and nurses. You have great books, games and art activities planned but feel you need a little more. Which of the following would be a really good way to engage the children in active learning? A. Watch a movie on doctors. B. Have a doctor's office center for the children including things like dress-up clothes, gauze, tongue depressors, and prescription pads. C. Sing a song about nurses. D. Show the children a stethoscope. Answer B. All of the choices would be acceptable ones for your unit. However, creating a play area where they could dress up and pretend to be doctors, nurses and patients would allow them to really become engaged and use imaginative play. Children learn by doing, and anytime you can create play opportunities for them, you are helping them explore the world in a way that is meaningful to them. Adam is playing with the toy drum and Matthew tries to take it from him, resulting in Adam hitting Matthew. Both boys are very upset. What should you do? A. Call Adam's parents, he needs to go home if he is hitting other students. B. Send them both to timeout for 30 minutes. C. Help the boys tell each other why they are upset and talk them through how they can work this out. D. Take the toy drum out of the room, it is causing too many fights. Answer C. Allowing students to work through difficult situations will help them to gain the skills to handle these situations better going forward. A child will often hit another child because he doesn't have the words to express himself. The more you can facilitate positive relationships, the better the learning experience will be for your students. When creating your classroom schedule, you should be sure to plan for A. Outside play every day. B. Children's personal needs such as putting on jackets and toileting. C. Art lesson every day. D. Music every day. Answer B. while it would be ideal to assure you have art, music and gross motor activities every day, it is plausible that some days the schedule will not allow for that. However, children will need to address their personal needs each day without fail. Time for eating, toileting, resting and putting on coats, sweaters, shoes or hats needs to be included in all scheduling. Stephen is 4 years old and is going to kindergarten next year. He also has an IEP and is seen by a special education teacher once a week in your classroom. What is your role as it pertains to Stephen's IEP goals? A. You really don't need to concern yourself with those goals. His special education teacher will do that. B. You should be aware of them. C. Your weekly planning should include opportunities to Stephen to work on his goals even when his special education teacher is not with him. D. Your assistant should be with Stephen at all times to assure he is doing what he should be. Answer: C. Stephen is a student in your class who happens to have an IEP. He is still your student and you are still responsible for his education and emotional well-being. His IEP goals should be part of your weekly planning. However, he should not be set apart from other students in order to work on those goals. At this age, IEP goals are easy to incorporate into your lesson seamlessly, giving not just Steve, but all students a chance to practice or further develop a skill. Sally's mother tells you Sally has been crying about going to school for the past week and she's worried that something has happened to make Sally not like school. This is not usual behavior for Sally. You're not aware of anything that would cause her to feel that way. What should you tell Sally's mother? A. This is normal. All kids cry. Don't make a big deal out of it. B. Tell her to keep Sally home until she feels better about coming to school. You don't want to force her and you can't have a crying child all day. C. Tell her you are not aware of anything that has happened but you will watch Sally closely over the next few days and try to see if there is something unusual going on. Let her know you will get back to her. D. Tell her to relax, Sally is fine once she gets to school. Answer: C. While many children do cry from time to time about going to school, if it is not typical behavior and Sally is saying she doesn't want to go to school, it is best to work with her mother to find the cause of Sally's anxiety. With small children, it can be something we, as adults, do not realize is causing them to be upset. Keeping a close eye on Sally's interactions and communicating with her mother will help you reduce Sally's stress and her mother's, too.